All right. Good afternoon, everyone, and good morning, depending on where you're calling in from. Welcome to It's Worth a Shot. Today, we're going to be talking about the Viven Health platform. Let's go ahead and go to the next slide. Just want to share our disclaimer. This presentation may contain information presented by a third party, which in this case today it is. This information provided does not constitute endorsement or recommendation by Mountain Pacific. So let's go ahead and go to the next slide. We just wanted to include the COVID-19 vaccine update. Just as a reminder, there are some changes regarding the updated recommendations. So, and I've got it highlighted for everyone today. Just as a reminder, people ages 65 years old and older should receive one additional dose of the updated vaccine. So the 2023-2024 formula, and then at least 4 months following the previous dose of that same formula. So just as a reminder, those are for individuals not moderately or severely immunocompromised. And then there is the note there at the bottom for initial vaccination with the Novavax. The 2-dose series should be completed before administration of the additional dose. So just a reminder on that. Let's go to the next slide. And these are the continued COVID-19 updates. For the moderately or severely immunocompromised, there were no changes with those recommendations. So just as a reminder on that, we have included the links on the slides for those updated recommendations, so you guys can take a look at that. As always, don't hesitate to reach out to your account managers, and we can provide any guidance or additional information that you may need on that. Let's go ahead and go to the next slide. So just as a reminder, it is Colorectal Cancer Awareness Month. We have included the links here so you guys can do some awareness. And there's some really great campaign resources in there for you guys to share with your staff and your residents, your patients. So make sure you guys take a look at that. It's a really good opportunity to remind everybody to get their screenings as needed. We also wanted to do a shout out for all of our social workers. It is Social Work Month, so we want to thank a social worker. They're amazing, and there's so many things we couldn't do without them. So thank you, social workers. And then we are also sharing forward the frequently asked questions about enhanced barrier precautions in nursing homes. Make sure you guys tune in next week. We are going to be talking about enhanced barrier precautions, the good, the bad, and the ugly. So make sure you guys join us. It's going to be featuring Viola virus. So it should be a good one. Make sure you guys tune in. And let's go ahead and go to the next slide. So as always, we appreciate your feedback. Make sure that you guys drop any ideas that you have for future It's Worth a Shot sessions. We want to make sure that we're meeting your needs. We are going to continue to meet every Wednesday. And then at the end of the session, we appreciate your feedback on the evaluation. So make sure you guys take the opportunity to fill that out as well. We really appreciate your comments and feedback. So we have a quick polling question. So do you know the differences between EBP, which is enhanced barrier precautions, and standard precautions? All right, we'll go ahead and stop the poll. It looks like about an 80-20 split, 83-17 split. So especially for you 17%, make sure you join us next week with Viola virus. So let's go ahead and go to the next slide. We just wanted to share some information on our weekly influenza snapshot. Montana is in the green. We're looking good in Hawaii. Alaska and Wyoming, we continue to have a little bit higher rates. So make sure you guys are taking your respiratory precautions. But overall, the respiratory illness trend is on a downward trend. So keep going, everyone. Let's go ahead and go to the next slide and we'll take a look at our weekly COVID snapshot. Across the nation, total hospitalizations, total deaths, ED visits are all on the decline. So that is wonderful news. It's good to see Alaska mostly in the green. There is a substantial increase on the Big Island in Hawaii. So take a look at that. Make sure that you guys are current with your COVID vaccines. And if you need any additional resources on where to find those vaccines, again, just reach out to your account manager. So let's go ahead and go to the next slide. And we felt that it was very timely with the updates with the COVID vaccine recommendations to discuss the wonderful Viven Health. And it's an interactive education platform and it covers vaccines. So we're happy to welcome back Natasha Dickinson to talk about Viven Health. Thank you, Natasha.
Thank you so much. And thank you all for taking the time out to hear about our unique platform again. So I am Natasha Dickinson. I am the Director of Clinical Affairs at Viven Health. Viven Health is an education company that focuses on interactive education. It is nurse-founded, nurse-led, and we are different than traditional education programs because we focus on interactivity. Okay, next slide, please. So our education is very unique, is actually patented, and we provide education through the use of a QR code or a website link. So if you have a cell phone, a tablet, or a computer, you're able to easily access our program. Our program is different from the traditional passive learning, where a person would just kind of click, 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 or they watch a video, or they have to read something. Our education is all about doing, all about interactivity. And research has shown by that doing this type of education, not only does the learner learn, but they also are able to have a behavior change. And of course, whenever you're teaching something, that's what you want, is that behavior change. So in addition to this, we are able to provide user participation reports on a weekly basis, and that's because of that unique QR code. So facilities or organizations that participate in our program, they get weekly reports on who's using the program. And that can be used just to show, God forbid, a surveyor that you all are compliant in infection prevention. And just also to show that you are proactive in infection prevention in your facility and organization. Next slide, please. So this program is completely free to you. It is underwritten by Mountain Pacific as your quality improvement organization. And it's a program that's not only just for your staff, your residents, families, it's for everybody. So it's for healthcare professionals, it's for grandmas, aunts, uncles, residents, everyone. The whole goal of this is to educate people and equip them with a resource that they can use to get vaccinated and prevent sepsis. So the available programs that are free to you are the sepsis and combined vaccine program. I like to mention that it is available in multiple languages, not all languages, but many languages. If there is a language that's not available that you don't see, we are happy to try to get that language for you. You just let us know. And the languages can be changed with the touch of a button within the program. Okay. In addition to this, all of our education is provided at a 4th grade reading level. And that's just because we want to make it easy for everyone to comprehend. Like I said, this program is not selective just for healthcare professionals or clinical staff. It's for everyone. So we want to make sure that everybody can really get a good understanding of the material. I like to say that it is comprehensive education provided in a bite-sized bit. And with that being said, the program doesn't take long at all to complete. Next slide, please. Okay, so what do the programs offer? So for the sepsis program, the big thing right now, I know that CMS is pushing for is just reminding people and emphasizing that sepsis is a leading cause of hospital readmissions and nursing homes. So we really want to kind of get a handle on this ahead of time to protect, our residents, our staff, and everyone. Sepsis is a very potentially deadly disease in residents, especially vulnerable residents. So, by completing this program, it helps educate and kind of give some critical thinking skills to identify sepsis and to prevent it. The other program that is available to you all for free is the Combined Vaccine Program. This program combines up-to-date information on all the vaccines. I think as Jamie mentioned before, the updated COVID recommendations are in the program. So this is great just to kind of reiterate the importance of getting vaccinated. I know a lot of times right now people are kind of over vaccinations, but this provides education in a non-judgmental and we're not forcing anything onto people. We're just providing them with the education. And from that, we hope that they make that right informed decision. But the goal is just to be proactive. We want to provide the education so people can make those good informed decisions. And the beauty of it is this is just a turnkey resource. There's not much required for the person implementing the program. All they have to do is just pass out that QR code. And we help with that part as well. Okay, next slide, please. Okay, so if it's okay with you, I'm going to take a pause and just ask for any questions, and then I'm going to demonstrate the program so you all can kind of see how the interactivity works. Okay, is it okay if I share my screen now? Okay, thank you. All righty. Uh-oh. 1 second here. All right, just let me know when you can see my screen.
We can see it. Thank you.
Okay, perfect. Thank you. So I'll just briefly show you the vaccine program just so you can kind of get an idea of how the interactivity works. So we try to keep videos down to a minimum. If you see any videos throughout the program, it's going to be less than 30 seconds because we're not about passive learning. Like I said, we're all about doing. So this right here is one of the modules that just kind of shows the benefits of being vaccinated and unvaccinated. So this one is actually a video, but it's very short. Let me make sure my volume's on here. Okay, I think it is. Okay, so here we go. And like I said, the videos is just kind of reinforce the idea of different topics. So for these videos in particular, it's just going to really reinforce the idea of what happens when you're not vaccinated and what happens when you're vaccinated. Your body does not have extra defense to protect.
Natasha, your volume is not working as well. The video's not,
It's not, the volume's not working.
no.
Oh, goodness. Okay, hold on one second. Let me stop sharing for a minute. Thought it was clicked.
I could hear it. I think it's just really low.
Okay.
When you're sharing, you just have to click on the sound. Share
Oh, oh, yep, I see it right there. Yep. Okay. All right. Sorry about that. Okay. Can you all see my screen again?
Yes, you can. Thank
Okay,
you.
perfect.
When you are vaccinated, you give your body the antibodies it needs to fight off the virus. As your body is primed to fight the virus, you are likely to experience less severe symptoms and be less susceptible to significant side effects when you contract the virus. You will also have much less of the virus in your body, reducing the chances you will spread the virus.
Okay. So that's just a brief example of one of our videos. And another thing is, like I said, we try to keep words down to a minimum just because we are trying to get away from that passive learning and go more toward interactivity. So this right here is one of our concepts we use to educate. This is where a person is going to learn about what are the benefits of, say, a pneumonia vaccine and the comorbidity, what happens whenever different factors occur. So for instance, someone over the age of 65, if you look at the germs, they wake up because it makes them more susceptible to pneumonia. If you look at someone with lung disease, what happens? Those germs, they're going to wake up because once again, they're more susceptible. The same with heart disease. They're more susceptible. And everything you're seeing right now, it is not a video. It's actually me doing. So I am moving my mouse to see each comorbidity and what happens. We also try to take it a step forward and get an emotional response, showing people what happens if they don't get vaccinated or the potential what could happen. A lot of times that emotional impact really does help make a person with their decision making. Okay. We also want to demonstrate what happens if you do protective things like hand washing. It's going to help shield you from pneumonia, or cleaning surfaces. Same thing. And then what happens if you actually get that vaccine? It's going to help eliminate those germs altogether. Now, like I said earlier, this program is not just for medical professionals. So the images may be, they're gamified, but we want to make it like that just to make sure that people are getting the concept. So it may not be all scientifically accurate with the pictures, but we try to get the concept down and we make it easy for everyone to understand. I'll show you another one here. So just teaching about side effects. And nothing that we teach is brand new information. It's information that people know. We're just presenting it in a different way, in a different format. So one way that we do teach is called discovery learning. So someone who has no idea about vaccines, by doing this particular module, they're able to determine what are side effects of vaccine through discovery learning. I like to kind of call it trial and error. So if you would try to put the wrong slide in the wrong location, it's not going to stick. Just like that, it goes right back. So it makes the learner choose that right location in order to understand the concept better. And everything you're seeing right now, like I said, it's not a video. It's actually me moving my mouse to do it. All right. And we will send you all a link and to the program. And also you all, the facilities anyway, should have received a packet in the mail with the postcards in it. Can
And
I go back
Natasha,
to?
This is Jamie. So the account or the nursing homes,
Yes.
the packet that you all received, it does not have a logo of Mount Pacific or Viven Health on it. It came directly from the printer, so it should be coming, I believe, in a white or a manila envelope, and it will have the
Yes.
information in there.
Yes. I think it's Vista Print. That's who we use. So it's going to be coming from Vista Print. Okay. So I've showed you how easy it is to use the program. I'll now show you how easy it is to actually implement. So step one, which we've already did that, which was we've sent the postcards to everyone, every nursing facility. The postcards do have that QR code on them, which make it easy for accessibility. If you have not received your postcards in the mail, if you could just write that down in the chat, and we'll be happy to send you another set of postcards. Okay, and the postcards were all addressed to the administrator, if that helps as well. Okay, next slide, please. Step two, all you have to do is just distribute the flyer. So you can distribute it by passing it out to your staff members. If you're a community partner, you can put it on a bulletin board. You can put it on a front desk. There's no limit to distributions, whatever works best for your facility organization. Next slide, please. And for the nursing facilities, what a lot of successful facilities do is they host a staff in-service. With that staff in-service, they educate about the program at that time. They pass out the postcards to their staff, and they have everyone scan right then and there. They scan the QR code, and they're able to get started. Others may have the activities director incorporate the activity with the residents. Like I said, there's no limit to distribution. Okay, next slide, please. Step three, like I said, just scan that QR code. As you saw earlier, it's very quick to do each module. The sepsis prevention program maybe takes about 20 minutes to complete, and the vaccine program takes less than 10 minutes. So we're able to provide a lot of information just in a little bit of time, just based on the interactivity. Next slide, please. So this is for the nursing homes, and we'll be getting the community organizations, your link to you shortly. But if any nursing homes are out there and want to just give it a try to see how easy it is to get started, just get your cell phone out and just scan that QR code. And I'll give you a little bit for that.
And I did put links for each in the chat. There is a separate one for nursing homes or the community. So if you guys don't have your phones on you or you struggle with those QR codes, there is a link in there also.
Thank you, Jamie.
Yep.
Okay, so next slide, please. So once you scan or you click that link, next you just register. All you do is you can type in your facility name. Mountain Pacific has been amazing, and we have already registered all the facilities in the database and the community partners. You fill out your name, your email, and your phone number. And I always like to emphasize the fact that we do not use your information for anything other than this. So we're not going to spam you with anything, any additional emails or anything like that. We are just trying to get as much, participation, and we want to be effective with this program and really make a difference for everyone. Next slide, please. And step 4, we do provide weekly reports. So once you begin using the program and start having registered users, you will be getting a report every Monday. This will come from a Viven Health email. It's going to tell who's registered and who's completed the program. This gets sent automatically If there's somebody in particular that you want to receive the report, you just let me know, or let one of the Mountain Pacific team know. Right now, the DO and an administrator will be receiving the reports. Okay, next slide, please. And at the end of each program, once you complete it, you will get a certificate of completion. The individual does. And this is just showing kind of like positive reinforcement, congratulating someone, for participating in the program. And then a lot of the facilities in particular, they'll add the certificate to a personnel file. And at the end of the day, this is just showing that you all are proactive at infection prevention and sepsis prevention and vaccinations. By doing this education, we hope to get individuals involved and, like I said, make those smart, informed decisions. Okay, next slide, please. So what's next? For the nursing facilities, host a staff in service, educate about the program, know what it's about, how easy it is, how fast it is to complete, hand out the postcard and get started. For the community partners, it's just as easy. You can just educate any of the people who visit you, pass out that QR code with the postcard or the flyer, and have them get started. Next slide. And if you have any additional questions, you can always reach out to me by email or phone number. Or of course, you can always go through Mountain Pacific to get in touch with me as well. Any questions?
All right. I'm not seeing any questions. We'll keep it open for another minute, but
Okay.
we will go ahead and send out that community flyer and a copy of the nursing home flyer with our It's Worth a Shot reminder for next week. So keep an eye out for that. We'll be sending that out. And then again, just reach out to your account managers if you guys want to get set up sooner. We can definitely help you with that. It's a great, easy, interactive training module. So, and we can also help with any reporting. If you guys are already using the program and you want to know how your facility is doing, just let us know and we can also connect you with that.
Well, I want to thank all of you for your time once again. I truly appreciate it, and I look forward to seeing your participation.
All right. Just one more reminder, we put the link for the evaluation in the chat, so please take a minute to do that. And if you guys have any questions moving forward, please let us know. And thank you guys for joining us today. And make sure you join us next week. Same time, same place. Thank you, everyone.
Thank you.